right, here we go. It is Doc Talk time. My name's James Pikeway. Dr. Neil Galletly is joining us again. He's back in the podcast studio here at the Rove, and we're going to be talking livers, which I think this is going to be a lot of fun because, and why it's going to be a lot of fun is because as soon as Dr. Jenna said, hey, let's talk livers and let's get Dr. Neil back in, I kind of went, I don't even know what my liver is. And then I started thinking, okay, I've heard of liver disease and I've heard and I kind of went, I don't really know anything about a liver. Nothing. And I thought, so then you start doing some research and then I realized this is like the second largest organ in our body pretty much.
Yeah, it is. It's a big organ in the body there, and it's super important. It kind of acts as our body's factory or manufacturing center. It's a recycling center, and it's a waste disposal unit. So it's got a whole bunch of important jobs. We need our livers. We need to be looking after our livers.
I mean, that's what we're going to talk about today. Yeah. I kind of frame this as the 101 of livers, and let's start right at the beginning. What our liver does, where it is, why it's important, and then I'd love to talk about liver disease and all. I was even reading about cancer of the liver and issues with bile ducts, and I was kind of going, like all of this, it was like a whole new world just opened up to me. And I'm thinking, then you start reading about, how to maintain a healthy liver. And I'm just going, oh man, I'm wondering, I'm thinking I'm not a minority in the world of liver knowledge. And if there's anyone to help us get there, it's you, Dr. Neil. So
well, let's see if we can do that. And, you're totally not alone there. To be honest, I think a lot of doctors get slightly nervous when they see people with kind of blood tests showing they may have a liver problem. And it's like, oh, my goodness me, liver sounds scary. Where should we send the patient to? But, yeah, let's have a chat about livers. It should be a good conversation.
So how do livers fit into your specialty?
They're this sort of added bonus. Gastroenterology is, as you know, kind of like the tubes on the inside. So it's the stomach, it's the intestines, it's the colon. But like as a little added bonus, we get the liver and the pancreas as well. And I guess because the liver, it has a role in digestion as well. It's intimately connected to the gut. So yeah, I guess that's how we gastroenterologists get involved in liver disease as well.
When I want to jump back to gastroenterology just for a second. When you're studying, do livers factor in prominently in your studies, or is it, as you said, is kind of an add-on?
No, it's a core part of the training in gastroenterology. Now, if you want to go and work in, say, liver transplantation, that's an add-on because that's pretty super specialized stuff. But in terms of dealing with day-to-day liver disease, that's very much part and parcel of gastroenterology. And, in a typical clinic, you'll be seeing, a few people each day with liver-related issues.
Okay. So what does the liver do?
Alrighty. So,
let's just jump into it.
Yeah.
Hold on, I got to take some notes here.
So it's got a whole bunch of jobs. It's got like over 500 important functions, and I'm not going to, we could spend 45 minutes listing them all, and that'd be kind of tedious by the end. So I guess the main jobs are, so it's involved in the manufacture of important proteins. Things like albumin, which is a protein that's in your blood. It kind of basically keeps the fluid in your veins and stops it seeping out into the tissues. It's involved in the manufacture of proteins that help the blood clot. So again, vitally important there. It's involved in carbohydrate metabolism and fat metabolism. It's a store of nutrients. You have glycogen being stored in your liver. And it's really important for taking out nutrients, taking out chemicals, potentially detoxifying toxins in the blood, and particularly blood coming from the gut. And it's involved in the production of waste products. It makes bile, this yellowy liquid. You've got tubes running down through your liver into which the liver drains bile. And bile has a few jobs. It's involved in the excretion of waste products, but it's also important in the digestion of fat fat. So a whole bunch of important jobs that basically keep your body running, keep your body functioning.
I mean, it sounds like almost a complete ecosystem of things that are going on in our body that are somehow connected to the liver.
Yeah, and if your liver's not working well, you're pretty sick.
What percentage? And I just ballpark figure. What percentage of people begin to have liver issues? Is this a pretty predominant group of people? And I'm not saying where they are on the on cultures, etc., but just in general, liver issues affect most of us at some point.
So I guess mild liver issues will affect, probably 20, 30, 40% of the population at some point. Fortunately, more severe liver issues, they're pretty rare.
Okay. What are mild liver issues?
So that's, for example, you've got, say, a little bit of fat in the liver, or you've got some mild underlying liver inflammation, but it doesn't progress. It doesn't get any worse than that. It doesn't have an impact on how the liver functions. Okay. So if getting fat in a liver is an issue? Getting fat in the liver can potentially be an issue. I mean, there's this this thing called fatty liver disease, or to give it its full title, non-alcoholic fatty liver disease. Yeah. And we give it that title to kind of differentiate it from the similar sort of fatty changes you can get in the liver in people who drink too much alcohol. But generally when we're talking about fatty liver disease, we're not talking about the changes due to alcohol, but we're talking about fat deposition in the body due to underlying conditions such as high blood pressure, such as diabetes, such as high cholesterol, such as obesity, particularly carrying too much weight around your midriff. And, these are all super common problems in the Western world and also here in the GCC.
So, and this is, fatty liver disease, I've been reading about this, and it's huge.
Yeah, they say kind of up to about 30, 40% of all adults in the US have some form of fatty liver disease,
The one of the issues, as I'm reading about, let's stick with fatty liver disease for a second. But as I'm reading about things with the liver, one of the issues is sometimes it's hard to actually, things are going on with your liver, but you don't necessarily notice it until way down the line. And you can live pretty comfortably without any sort of symptoms that are, jumping out at you. And I thought, this is kind of scary.
Yeah, I guess it is. And you're absolutely right. I think the majority of liver issues are only discovered by chance. Yeah. Maybe you have some blood tests for some other problem, or as part of a health check, or an ultrasound scan of your tummy looking for other issues. And the doctor notices, okay, there might be something going on with the liver here. And, your liver, there's this huge organ. It has very, very few nerve endings. The only nerve endings in the liver, in the capsule, the surrounding, the surrounding capsule of the liver. So inside the liver, there's no nerve endings.
So there's nothing to hurt.
Pain from the liver. There's nothing to hurt. Absolutely. So you can get inflammation in the liver. You can get scarring in the liver. You can get infection in the liver, and you may not know about it.
This as an organ, the more I read about it and the more I hear about it, and as you're talking about it, it becomes kind of fascinating in that it does so much, yet it kind of just works in the background.
And what's really amazing about the liver? It's kind of pretty much the only, solid internal organ in the body that can regenerate itself. So you can remove up to about 75% of the liver, and without the remaining 25%, it will kind of regrow new cells. It'll regrow the capacity of a full liver. And also there's a huge amount of reserve there. So you could kill off 80, maybe 90% of liver cells, and your liver would still pretty much just about function normally. But once you get over that tipping point, once you've got something going on in the liver that kind of kills off more cells, you get below that 10% mark, that's when you start getting big problems, because all those vitally important jobs of the liver is not doing so well.
And you could get down to that mark and not really know things are going on because you've got no nerve endings. You're not feeling any pain, unless you notice other things, byproducts of the liver that are, bifunctions of the liver in the rest of your body that are kind of going wrong.
Yeah, absolutely. And worldwide, that's why liver disease is such a big problem, because it's, you can have issues with your liver for years and years and years, and you wouldn't know about it.
issues with your liver, and if you've had it for years and years and years, because it regenerates, because it can regenerate, is it one of those situations where if things are all going wrong and you catch it a little later, it's still bad, but there's hope? Is it one of those kind of situations?
Yeah, I think that's the case. I think if there is an underlying liver problem, an underlying disease that causes long-term inflammation in the liver, then, even you catch it, a number of years down the line, if you then remove whatever's causing that inflammation or suppress whatever's causing that inflammation, you can stop the damage to the liver and it has a chance to recover somewhat. Now, there are, certain stages of liver disease that one can't necessarily recover from. So if there's significant scarring in the liver, if there's liver cirrhosis, well, that scarring is probably always going to be there, but your liver can still regenerate a degree of capacity and you can live a pretty normal life.
Interesting. So let's jump back a little bit, because we've got lots of different terminology that's been going on here. And we're talking about words that people are, scarring of the liver and cirrhosis, and we're hearing all of these things. And look, we all watch way too many medical shows, so we've heard these things. Let's jump back to when we start talking about different diseases that can affect your liver. Can we go through just a little list of some of the things that we want to keep our eye on, some of the things we want to be thinking about, and possibly what the implications of some of these things that can go wrong with our liver are?
Yeah, absolutely. So I think a really good way of looking at it is maybe dividing things into acute liver diseases and chronic liver diseases. Okay. And I think it's worth explaining those terms
I think so, because you know what? It's like everyone, and sometimes people will say things and we hear the words all the time, acute, chronic, and it's like, oh yeah, and then people get say, oh, I gotta look this up on Google. I have no idea what we're talking about here. Yeah,
no, you're absolutely right. And I think, as doctors, we're pretty guilty of just kind of bandying around medical words that we know what it means, but we kind of forget that they're medical words and people may not necessarily quite get it. So, alrighty, acute diseases, whether we're talking about livers or whatever, really we're talking about diseases that, last for days or possibly weeks.
But they'll go away.
Yeah, they will typically go away. Whereas chronic conditions, we're talking about diseases that last for months and typically for years. So it's a matter of time. Acute are kind of short-term things. Chronic is kind of long-term things.
Okay, so we've got acute and chronic liver issues. When we start looking, so let's start with acute.
So with acute, you've got something, and most things that make the liver upset tend to be inflammation of the liver, and inflammation in the liver is what hepatitis is. Hepatitis is just one of those medical terms that we doctors like to bandy around to confuse people, and it just means inflammation in the liver. Anything with itis means inflammation.
So we're talking hepatitis, inflammation. Are we talking, when I say inflammation, when you get kind of an inflammation in your arm and you kind of see something kind of getting, is it that kind of inflammation where you physically get some swelling? Or
so you can get a bit of swelling in the liver inflammation, but remember, it's deep inside, so you can't see it. You might get a bit of kind of mild discomfort on the right upper side of your tummy, which is where your liver's located, but generally you wouldn't feel too much. But yeah, if you were to kind of dive into your body, if you were to miniaturize yourself and go in there, or sort of cut open the liver, you'd see that it was inflamed, it was a bit red, it was a bit swollen. Absolutely.
Okay. All right.
So acute things. Generally, there is a brief insult to the liver. There's something happening to the liver to make it unhappy. And as a result, you get inflammation. You get the markers of inflammation going up in the liver. And then your body gets rid of whatever's caused the insult, or it goes away, or you stop taking it. And then the inflammation in the liver gradually over days or weeks settles down completely back to normal. So typically there's no long-term liver damage from an acute liver injury, from acute hepatitis.
So when you get an acute situation, something has come in to make the liver unhappy, and hopefully you've removed whatever you did to cause that, or the situation that you were in, so that it goes back to living in a relatively normal environment.
Yeah, absolutely. That's completely it. And the sort of things that can make the liver temporarily unhappy like that, well, we've got viruses. So the hepatitis A virus is a really good example of this. You get infected by the hepatitis A virus. It's often transmitted through contaminated food or contaminated water. It makes your liver sick. It makes your liver inflamed. You'll kind of feel tired. You'll feel lethargic. You may feel a little bit fluey. You may get a bit of discomfort. You may well become jaundiced, and that's because your liver isn't processing the bilirubin, the bile so well, so it's building up in your bloodstream, and you can see it in the whites of your eyes. And then over a week, 2 weeks, 3 weeks, your body will get rid of the virus completely, and the liver will breathe a sigh of relief, and the inflammation will go down again. But, it can take about 6 weeks or so.
That's a long time.
So potentially, you can take 6 weeks to get full recovery, but, pretty much almost always you do recover from this. So hepatitis A is a good example.
Is hepatitis A something you can get a shot for? I know that's hepatitis C, right? I think that
it's actually not. Hepatitis C is the one of the alphabet of hepatitis, and we can talk about those later. Is the one that you can't get a shot for.
Right.
So hepatitis A you can get a shot for, and it protects against infection. So it's definitely a worthwhile thing to do. Other viruses that can cause an acute hepatitis, hepatitis B, and we'll talk a bit more about that in a moment, because that's an interesting virus. COVID can cause an acute hepatitis as well. Yellow fever can cause an acute hepatitis. But I guess the big viruses are hepatitis A and hepatitis B that can cause an acute hepatitis. Now, on top of that, there's other things that can do it. For example, drinking ridiculous amounts of alcohol in a short space of time can cause an acute hepatitis. Taking certain medications, a few antibiotics have got hepatitis as a potential side effect, and as soon as you stop taking those antibiotics, the hepatitis tends to improve. Other medications, before I moved to Dubai, I used to work in China, and herbal medication is quite popular there. And quite a few different herbal medicines can potentially cause liver inflammation as well. So it was something I saw a few times over there.
Which is a crazy thing, because we always think herbal things, okay, no side effects. There's no garbage in them. This is going to be good. I mean, and yet so many byproducts in
and
herbal
in
medicine.
fairness, quite often they can be good. And
Sure.
A whole bunch of stuff that we don't really understand about it. But equally, you don't really know what's in there. You don't know what chemicals are going to be in there. And there certainly are chemicals in herbal medicines that can irritate and damage the liver. And pregnancy actually is interesting.
Get out of here.
Yeah, absolutely. It's weird, isn't it? But particularly in the later stages of pregnancy, there are a few, fortunately, very rare conditions where all the hormonal changes cause liver inflammation and can cause an acute hepatitis, and that can be something that can be pretty dangerous for both the mother and the unborn child. So yeah, and
I've never heard of that one. That one's new on me.
It can happen. It's pretty rare, but it can be an emergency. It can call for an early delivery and that will typically stop the issue.
Yeah. Wow. Okay.
So these are all the sort of things that can cause an acute hepatitis. As we said, a hepatitis inflammation in the liver that lasts for days or typically a few weeks. And, you get pretty unwell from it potentially for a week or so. And then your liver recovers. You get rid of whatever's causing the problem and everything goes back to normal.
When you say you start feeling unwell, what are the symptoms that start to creep in as you're dealing with these things?
So typical things may include tiredness. They may include kind of maybe feeling a little bit fluey, particularly if it's a virus that's causing it. You may feel a bit achy. You may get a little bit of mild discomfort in the right upper side of the abdomen. Depending on the degree of liver inflammation, you could get the jaundice we mentioned earlier. And in very, very severe cases where the liver is really quite sick, it's not functioning well at all, you can get increasingly confused, increasingly sleepy, sleepy. You may find maybe that your blood isn't clotting so well, you're bleeding easily, because remember we spoke earlier, one of the important jobs of the liver is making those proteins that help the blood clot.
Which I never knew either. Like this is pretty important.
Yeah.
Okay, so all these things start to creep in, and as this is starting, and I guess as it's prolonging, if you're feeling a little tired, we all feel a little tired once in a while. We all have a little ache and pain once in a while. But if it's persisting, time to go see the doctor and have a chat and not rely solely on Dr. Google, because at that point you're going to think your life's over.
Well, that's true. Yeah, no, so many people with whatever problem, they come to see me in clinic and say, I read on Google, ...
Yeah. It's like your eyes roll into the back of your head. It's like, wow.
And, you can get a lot of super important information from the internet, but I guess it's all about context, isn't it?
Yeah.
But definitely, if you're kind of concerned, showing any signs of jaundice, the whites of your eyes are going yellow, your urine's starting to look like tea, go along to a doctor, get that checked out.
I mean, those are two easy markers, aren't there?
Those are two easy markers, yeah.
I think we had a child, and I know one of my boys, newborn, had jaundice, and it was kind of weird. It was, you're looking at him, whoa. And for him, this is a newborn. So it was, keep him in the sunlight, and it all worked out. But it was interesting. And then, as you said, when your urine is kind of looking like tea, and you're drinking and you're doing everything, you're hydrating, and that happens. That's another good marker. It's like, okay, yeah, go get a check.
Totally. That's a really good reason to go get checked out. Yeah.
Okay. So that's acute. Chronic.
So with chronic inflammation, chronic hepatitis, chronic liver disease, typically what we're talking about here is long-term, usually quite low-grade inflammation in the liver that is going on for years and years and years. And because the inflammation's pretty low-grade, generally you won't notice any symptoms of this whatsoever. But it's insidious. And the trouble is this kind of ongoing low-grade inflammation. It can damage the cells in the liver. It can cause liver cells to start dying off and being replaced by scar tissue, or what we call fibrosis of the liver. And then potentially over time, you can get enough liver cells dying off. You can get enough scar tissue in the liver that the majority of the liver has been replaced by scar tissue. And that's what we're talking about when we talk about cirrhosis of the liver. Cirrhosis is sort of pretty much just sort of end stage scarring of the liver. And it's reaching the point where the liver is kind of at that tipping point between being able to continue functioning and not being able to do some of those vitally important jobs. And a word about cirrhosis. So like so many people think cirrhosis equals alcohol.
Yep.
And of course, alcohol is a cause of liver cirrhosis. Probably in the West, it's the most common cause of liver cirrhosis, but it's by no means the only cause. Anything that can cause chronic, long-term liver inflammation can cause liver cirrhosis.
Now, if I'm coming for my regular checkup, and I'm doing my fitness checkup every year, and I'm getting the battery of blood tests, and I'm getting poked and all these things, would the medical tests that are being done, would they identify some of the a long-term mild inflammation in my liver? Would they pick it up?
So I guess the short answer is usually. Okay. So as long as they're doing what we call liver function tests, and a lot of, health screens will include basic liver function tests as part of this. Two of the most important markers on liver function tests are blood tests called ALT and AST. And basically ALT and AST, they're markers of liver inflammation. And what you're looking for, you're not looking for them to being sky high. Yeah. You're looking for them to be subtly higher than what the lab is saying the normal range is. So for most of these things, we say anything above 40 is slightly elevated. So you're looking for subtle elevations of the ALT and the AST blood tests. So those could be a marker that there may be something going on. You don't always necessarily see it on a one-off blood test, so compare with blood tests from the previous year. And a lot of health checks also include a liver ultrasound scan. And a liver ultrasound is a great basic screening test of the liver. It will show if it looks like there is any buildup of fat on the liver, this fatty liver condition we spoke about earlier. It will show if the liver is looking in any way irregular or maybe potentially scarred. And of course, it's a great way for looking at any lumps and bumps in the liver that shouldn't be there.
So this is, I mean, it's kind of, it's not an exact science in a sense, is it?
It's not an exact science, and but it's as we said earlier,
there's lots of tools. Symptoms. There's lots of tools.
There are lots of tools, and it's about if you avail yourself of the tools, if you go for that yearly health check, you're much more likely to pick up if there are any subtle underlying issues going on than if you go, well, I feel fine, la la la, who cares?
Yeah, and I think this, especially with the liver, because you're not going to feel anything necessarily, and unless you have some big issues going on, you're not going to notice anything.
Yeah,
and that, to me, that becomes sort of that little nagging alarm bell in the back. Says, you know what, let's just make sure so that we don't get down the road and it's like, oh, this has been going on for a long time, and we should have checked this. It's like, well, I haven't been in for a checkup because I don't need to see doctors. So this is something to keep our minds on for sure.
Sure.
What else falls into that category when we're talking about chronic liver issues?
So, well, let's maybe have a think about the sort of things that can cause these sort of chronic inflammation.
Even better.
Yeah. So, as with acute hepatitis, viruses can also cause chronic liver disease, chronic hepatitis. Hepatitis C, the one that we haven't mentioned yet, is worldwide is a common cause of chronic liver inflammation. Hepatitis C is quite a devious virus. It
seems to be all viruses are devious these days.
Yeah, that's true.
Look, we're our minds are constantly on COVID and all sorts of variations of the H1N1, and it's and things. All I'm getting from the world of viruses is that they're all devious.
They are all devious. That is very, very true. But, fortunately, a lot of them your body can get rid of pretty quickly. But hepatitis C is not like that. It's it's an undercover virus. So hepatitis C, it's normally passed on by blood. So things like dirty needles or unscreened transfusion products, things like this. And unlike hepatitis A and indeed hepatitis B, you often don't know if you've had an acute infection with hepatitis C. It doesn't often make you feel unwell. It doesn't often cause jaundice. You don't really know about it. But over 70% of people who get infected with hepatitis C, the virus will evade your immune system, your body won't get rid of it, and it'll take up permanent residence in your blood and in your liver. And you won't know about it because you won't feel anything, but, year after year after year, that unwelcome guest in your liver will cause this ongoing liver inflammation, it'll cause scarring, and, worldwide, hepatitis C is a major cause of liver cirrhosis, and also liver cancer, which I guess we'll talk about as well in a bit. So hepatitis C is an important one. Hepatitis B, which we mentioned earlier, causes an acute hepatitis. It often causes jaundice and, a few weeks of infection. In about 10 or 15% of people.
Oh, that's a lot.
Get it. It's not as bad as 70%.
No, but I'm just thinking 10%. Like I always grade it. If you're going somewhere and they say, hey, we're going to give you a 10% discount on that. It's like, hey, I'll take a 10% discount. So I'm thinking that's not a good number, 10%.
Well, that's true. So, 10, 15%, so even bigger discount there of people who get that acute inflammation with hepatitis B. Again, their body won't completely get rid of it, and it'll take up residence in your liver, causing long-term low-grade liver inflammation.
So before you go on, so we got hepatitis C, which we have an idea how we can work to not get hepatitis C. How can we protect ourselves against hepatitis B?
So hepatitis B is generally transmitted through body fluids and blood. So again, dirty needles is a common reason. Unsafe sexual practices is another reason. Unprotected sex can potentially pass it on. And also, particularly in China, for example, passage from the mother to the baby, either through the placenta or through breast milk, is another possibility. So what we call vertical transmission to the baby is quite a common thing. Fortunately, it's less of an issue these days because of programs of vaccination and checking for women and making sure that they don't have underlying hepatitis B.
Yeah, I mean that's an area that often comes to mind, not in talk about liver disease, but I'm thinking Africa and HIV, again, passing with mother to child. And this is an area that is, again, really important to think about with viruses and other things.
Yeah.
Getting passed to someone who has done nothing. they're just born, and that's, they just happen to have inherited something that is kind of nasty.
It is, absolutely. It's kind of a nasty thing. And, there are things that can be done if it's found, but with hepatitis B, prevention is definitely way, way better. So hepatitis B, hepatitis C worldwide are the most common reasons why people can get chronic liver disease and all the complications of that. And those viruses, they're particularly common in Africa, particularly sub-Saharan Africa. They're particularly common in East and Southeast Asia, somewhat common in Central and Central South America. Whereas in the Western world, and also I guess in the GCC, probably the more common reasons for getting chronic liver inflammation, in the West, alcohol is a common reason, and then fatty liver disease, which we mentioned earlier, because of those comorbidities, those diseases is associated with the blood pressure, the diabetes or the impaired glucose tolerance, the obesity, the elevated cholesterol. These are all common conditions in the West. They're common conditions here in the GCC. So these are maybe more common reasons why one might get a more chronic liver disease here.
So then when you start stacking, you got diabetes issues, you got high cholesterol issues. So you got 2 for 2. And then we've got, keep going down the list. You could put all of those together. This is not good.
No, exactly. And, those conditions often go hand in hand. Yeah. People with high blood pressure often have these other conditions.
Yeah, high blood pressure, high cholesterol, if you're high fat diet, and suddenly you're just stacking everything on it. You're putting yourself at risk.
No, absolutely. And, people with these conditions, they're definitely more at risk of their bodies putting down fat in the liver, just as they can put down fat elsewhere. And their liver doesn't like fat. The liver cells try to get rid of the fat, and that causes inflammation and can cause all those complications of liver disease. So, you can be a complete teetotaler, go nowhere near alcohol in your life. And yet if you've got those conditions, if you've got fatty liver, you could end up with cirrhosis just as much as if you're kind of, a bottle of vodka a day, man.
Just as we try to get rid of fat on other parts of our body, does this also, do those techniques and those things that we're doing, dieting, eating better, etc., do those naturally filter through to the liver and the fat disappears from there as well? Or
yeah, it can. And trials on treatments for fatty liver have shown that gradual weight reduction, we're not talking about crash diets here, we're just talking about
lifestyle.
Lifestyle, the exercise, the sensible eating. That is the best way of reversing fatty liver, of reducing inflammation in the liver, reducing the likelihood of ongoing liver inflammation and liver complications. So, and, patients sometimes look slightly disappointed when I say that. They're kind of like hoping, look, here's this pill, just take this and you'll all be sorted. And in fairness, there are pills that are undergoing clinical trials in the moment that sound pretty interesting and exciting. Yeah. But at the moment, it's plain old boring diet, exercise, weight reduction, but that really will make a difference in reducing fat in the liver and reducing your risk of getting liver issues.
I mean, we're so lazy. I mean, this is the other thing. It's a lot of this is just common sense, right? But no one wants to do it. It's a little bit of work to actually think about what I'm going to eat. It's a little bit of work to cut back on those things that strong red meat diet. It's a little, not red meat's not bad, but in moderation, and it's a little bit of work. And no one wants to do that work. I want to just keep enjoying the way things are going. So it's a real challenge, but I get do you think people are waking up to this a little bit? I mean, when they come and see you and when they're talking about it, they realize that, okay, you know what? It's really not that hard. And there is a nice knock-on effect to having a healthy lifestyle. And do you get a sense that when people are coming to you and they've got, a liver disease or something that's, that they could actually reverse, that they kind of have that aha moment and it's like, okay, it's worth it?
It's certainly the case in some people. So, okay. There's some people you give them the talk about, this is what's going on in the liver. This is what you need to do. And 6 months later, they come and see you. They're kind of, they've shed 8 kilograms or so. You do their blood tests, their liver markers are looking way, way better. And that's really gratifying. But equally, there's a bunch of people that you give the talk to and it's, 6 months later, they're a couple of kilograms heavier. We're joking about it. It's a really, really difficult thing to do. And it's, it's not easy at all. But for those that are able to make those changes, it can really make a difference. And we're not just talking about their livers, we're talking about their heart health. We're reducing their risk of stroke, reducing their risk of a whole bunch of cancers and all sorts of stuff. So it's really important.
Well, this is, again, when we went back to the start of the show and you were talking about all the things, all the functions in the body that have a relationship with the liver, right down to blood clotting, which, wow. I mean, there's motivation to have a healthy liver because the knock-on effect is.
Yeah, but I don't know. I find it sort of, in diseases where people feel something, they feel bad.
This is the problem.
I need to do something. I need to get this fixed. Diseases where people go, well, I don't really feel it. You've done a few blood tests, but so what? It can sometimes be harder to get that health message across, but it's super important.
No, it's out of sight, out of mind. No one really knows where their liver is anyway. So, and don't feel anything. It's like, really, is it an issue?
Manana, exactly.
What can we do? People have a cancer of the liver. Never heard of this.
Alrighty. So let's talk about liver cancer. So liver cancer is kind of like a little bit of a confusing term because most cancers that affect the liver aren't from the liver. So,
hold on a second. Most cancers that affect the liver aren't from the liver.
Yeah.
Okay.
So most cancers that affect the liver are ones that have spread to the liver from somewhere else. Now, all the blood from the gut goes first of all to the liver before it goes elsewhere. So colon cancer or bowel cancer, stomach cancer, pancreatic cancer, all of these, if you've got a cancer in any of those organs, then cancer cells can quite easily spread to the liver and take up home in the liver as well, what we call secondary liver cancer or liver metastases, which is a word that we doctors use for kind of when cancer has spread to another organ. Breast cancer can do it, lung cancer can do it, all sorts of cancers can spread to the liver because so much blood goes through the liver. And so these are secondary cancers that are in the liver, but they started elsewhere. But I guess when we talk about liver cancer, generally we mean cancer that starts in the liver. And of these, there are two types. The main type arises from the liver cells themselves. We call that hepatocellular carcinoma or HCC. But you can also get cancer from the cells that line the bile ducts that run in the liver, something called cholangiocarcinoma. And that's much less common. So let's have a little think about HCC, the most common primary liver cancer. So if you have and most cases of primary liver cancer arise in livers that have some form of chronic inflammation. By far the majority do. So if you've got a healthy liver, your chances of getting liver cancer are virtually zero. But if there's been long-term inflammation in the liver, if there's been long-term damage to the liver, this long-term damage to cells, this long-term inflammation of cells can start cells changing and potentially becoming precancerous and cancerous. So the vast majority of cases of primary liver cancer we see in people with underlying liver cirrhosis or with other chronic liver diseases. Hepatitis B virus is particularly associated with liver cancer. It does something particularly nasty to the cells in the liver, and there's a particularly high risk of getting liver cancer with hepatitis B. So, the same sort of diseases that are associated with liver cirrhosis, your hepatitis B and C, your alcohol, your fatty liver, these are also the most common risk factors for developing liver cancer. Now, on top of that, if you have these liver inflammation, these conditions causing liver inflammation, there are a couple of other things that if you do will increase the likelihood of changes and damage to the cells causing cancer. And these include our old friend smoking, which, seems to be associated pretty much with every disease under the sun.
Yeah.
And, also, there's there's a toxin produced by a type of mold or fungus that lives on wheat or groundnuts in Africa and East Asia, something called aflatoxin. These are areas where hepatitis B in particular is endemic. And so exposure to these aflatoxins, again, increases the damage that the hepatitis B and other chronic liver diseases cause. But yeah, basically, alcohol, fatty liver, viruses, and smoking are kind of bad things.
So what do I do to just generally have a healthy liver? What can I do to just keep my liver function up? And hopefully I'm mindful of my exposure to other things, my hepatitis viruses and things, and I'm just at least not getting myself into a situation where those nasties can come knocking at the door.
Well, absolutely. I mean, sort of avoiding exposure to hepatitis viruses, the B and the C. A is not an issue in terms of these long-term things, but B and C, the things spread by blood and body fluids, it's important to avoid those. And hepatitis B is something that you can be vaccinated against as well. Hepatitis C, sadly, there's no vaccine at the moment, but hepatitis B, there's a good vaccine. Immunity levels will wane over time, so it's important to get boosters every, 8 to 10 years or so. So that's an important thing. But other things that we can do in terms of our general lifestyle, in terms of our diet for keeping our liver healthy. Well, alcohol, we said, is a common issue, particularly in the Western world. So either alcohol avoidance or moderation with alcohol is clearly going to have a big impact in reducing the likelihood of getting liver issues. And then fatty liver. So keeping on top of your weight, eating sensibly, taking regular exercise. These are other ways of reducing, the likelihood of developing fat deposition in the liver, and so reducing the likelihood of you getting long-term liver disease. So, actually, it's pretty simple to look after your liver. I mean, it sounds simple. Sometimes these things can be kind of easy to talk about and more difficult to do. But, your liver's a pretty resilient organ, so generally it'll look after itself. I mean, people often ask me in clinic, do I need a liver cleanse or something like that? I was going to ask you that,
because I see these all the time. Get this liver detox. It's going to, and I'm kind of looking at it going, really? It's like, I don't know.
Yeah, there's no evidence that these are going to be particularly helpful. The liver is, one of the jobs of the liver is detoxifying. And, as long as you're not damaging the liver by, drinking excessively or doing all these things that can cause too much fat in the liver, your liver does a pretty good job of detoxifying itself. So there really isn't any evidence that liver cleanses are going to be helpful at all.
On a side note, sometimes go by the butcher shop and you see the offals that people are cooking up, which liver is usually in there. I'm going, there's no way I'm never going to eat a liver if I have a choice. Never. Just from this conversation of all the things that happen in a liver, and I'm thinking any mammal has got similar function in their liver. You don't want to be touching that. That's not a good thing to eat.
Well, they're apparently full of nutrients. I remember when I was a little boy, my granny used to feed me liver on a regular basis.
To tell you this, right?
Yeah, quite so.
This is what we have available.
Yeah. And James, it didn't do me any harm whatsoever. So there we go.
Yeah, exactly. Man, are you finding a higher incidence of people coming into clinic being either having liver issues or just simply being more aware and more concerned?
Yeah, I guess that's true. I mean, here in the UAE, I'm not seeing the same number of people who, might be coming to see me in clinic when I was working in the UK with the hepatitis B and C, with the alcohol-related issues. I mean, of course they still exist, but we're talking about much lower numbers. But in terms of, people who might be having fatty liver, maybe something that was picked up on a blood test or on an ultrasound scan, I think there is a bit more awareness going on there. So we are seeing people, but equally there are people who, you flip through their old blood test results and you see for the last 10 years they've had slightly elevated numbers in the liver and, no one's really picked it up or no one's really said anything and it's just kind of gone by. So I think there is a lot more awareness that is needed and, hopefully doing podcasts like this will help a little bit in that direction.
October is Liver Cancer Awareness Month?
October is, and now obviously it's overshadowed somewhat by breast cancer and, understandably so. But, October is also liver cancer awareness. And, I'm embarrassed to admit, James, I didn't know that until this October.
Really?
I had no idea. I've been a gastroenterologist for I don't know how many years, and I didn't know it. And I guess,
I can actually tell you over 25 years.
Oh, there we go. Well, I'm glad you've got my CV there. So, back in the UK where I did all my training and most of my practice, liver cancer is, I don't know, something like the 17th or the 18th most common cancer. It accounts for probably less than 2% of the cancers we find. So, we see it, but it's, even as a gastroenterologist, I'm seeing much more colon cancer, much more pancreatic cancer, much more stomach cancer, and so on. And here in Dubai, it's not a particularly common cancer either. Whereas in other countries, it's way more important. Not too far away in Egypt, liver cancer, accounts for, I think it's about 20 or 23% of all cancers in Egypt. It's the number one cause of cancer there. It's the number one cause of cancer in a number of Southeast Asian countries. And this is, sort of due to in Egypt, hepatitis C is particularly endemic. In Southeast Asia, hepatitis B is a common issue. So it varies really very, very much from country to country, depending on the preponderance of those different risk factors for liver disease.
Last words on talking about livers. If you had advice to people, like your thoughts.
Goes well with onions and... yeah, okay. No, sorry, I forgot. I thought we were in the cookery podcast. So just, look after it. Don't be overly concerned because your liver's a pretty resilient organ. It's pretty good at looking after itself, but don't flog it. Don't, drink ridiculous amounts of alcohol. If you do drink alcohol, make sure you do it in moderation, that you're not doing it, sort of every night. And also just keep an eye on your weight. And that's general health advice that's going to be helpful for so many things. And if you do these things, check on your liver when you have a health check from time to time, but your liver's likely to be able to look after itself, but just don't abuse it.
There we go. The words from Dr. Neil Galletly. Thank you very much for joining us on the podcast. And if you want to get in touch with Dr. Neil, really simple. You can find him over, you can find him on Instagram at Dr. Neil Dubai, and we can get in touch with you over at the clinic, can't we? Also,
absolutely, yeah. No, if you have any concerns about your liver or any other gastro-related issues, please do come and see me in clinic. I work at Health Bay Day Surgery Centre on Wasl Road, just right next door to that great big green J3 mall.
There we go. Thank you very much for joining us on the podcast and look forward to talking to you again really, really soon. I'm James Pikeway. We're coming to you from the Rove Hotel, downtown Dubai. This is Doc Talk.